Amid an increase in COVID-19 cases, nationwide COVID-19 mock drills are being held. Now, the drills are being conducted to take stock of hospital preparedness. Both public and private hospitals are holding the drills. Now, India, remember, recorded 5,800 new COVID-19 infections in the last 24 hours. India's active case tally climbed to 35,199. Delhi, Maharashtra and Kerala are the states which have seen maximum caseload so far.
In the visuals you can see there's a medical official who is present at the booth who will be conducting a COVID-19 test, RT-PCR test, after which the patient will be taken for the further diagnosis. But definitely this is an important step as COVID mock drills are conducted across the nation as the cases are rising. More than 35,000 cases are recorded in India. And if we talk about Maharashtra also recorded 4,587 cases with one death. So it becomes really important to conduct such mock drills as we talk about the severity of the particular disease. And you can see in the visuals as well, the person is treated here by the doctors in this particular COVID lab, as you can see. After which the particular patient will be taken to the treatment centers depending upon the severity of his health condition. And in the visuals you can see that he is being taken to a booth for a COVID-19 positivity test. So definitely it's an important attempt. As we see, the cases are rising across nation, but definitely there is no worry and no need to panic is what government is also telling us. A mask has not been made mandatory by any of the governments, but people need to understand the severity.
The mock drill was mandated by the state and the central government, and it was very necessary because the last extensive mock drill that we had was in 2020, and then we had another a few months ago when the cases were on the rise. So 3 years is a pretty long time in the world of government hospital because our doctors get changed, our doctors get transferred, and a resident finishes his 3 years of residency. So the ones who have worked in COVID in the past may have passed out now or maybe appearing for the exams. And we have fresh 2 batches admitted last year in February and now in November. So they have not been exposed to COVID at its worst. So it's very necessary to train everybody as to how to deal with COVID cases, suspected or proven. And that was the whole purpose behind this mock drill, and I am very happy that it's going well.
Mainly to sensitize about this COVID pandemic to the doctors as well as to the paramedics. This mock drill has been planned today, and see how we receive the patient, the casualty, how to triage the patient, after triaging how to take the patient to the wards and the ICU setups, whether the ventilator is functioning or not, what is our oxygen capacity, and how about the overall arrangements and drug position in our hospital and PPE kit and other things. Everything was checked by our Honorable Health Minister along with our Health Secretary and the DME, and I think everything is in position. I think even if you get a high number of patients, if they come to our hospital, we have got enough ward space as well as wards are adequately placed.
Protocol Times now is trying to report responsibly on the COVID-19 situation, and that is why we are not trying to enter the ICU, because the doctors have told us to get inside only after taking proper precautions, and that's why we are not entering the ICU. So we are reporting you live from here. So a dummy patient was used, and the whole management of COVID-19 was employed in that process.